Hi everyone, it's Dr. Marcon. In this section, we are going to talk about mean arterial pressure and how each of the variables that make up mean arterial pressure are homeostatically regulated. So we're going to talk about stroke volume, heart rate, as well as total peripheral resistance. Again, this formula, MAP, or mean arterial pressure equals stroke volume times heart rate times total peripheral resistance, is one of the most important equations that we do. So in this section, we are going to fill out this table of the intrinsic and extrinsic factors that help regulate these three variables that make up mean arterial pressure. So intrinsic means that which is involved with the auto-regulation of the organ itself. And then we have extrinsic factors. These are three processes we talked about, such as influences from the autonomic nervous system, hormones, and other local factors. So make sure that you do memorize this formula and what happens when there's an increase or decrease in any of these variables. So the first variable we're going to talk about is heart rate. Heart rate, we know, is controlled intrinsically through the autorhythmicity of the heart. Specifically at the SA node, we know that the SA node or sinoatrial node will set the rate of the heart, and usually this is genetically set and can be adjusted by extrinsic mechanisms. Extrinsic control of the autonomic nervous system occurs with dual innervation. So we have dual innervation at the SA node and the AV nodes. So with parasympathetic control, so parasympathetic being our rest and our digest situation, with an increase in parasympathetic innervation or activity, we will have a decrease in heart rate as well as a decrease in conduction. We know the parasympathetic nervous system will release acetylcholine, which stimulates our muscarinic receptors, and usually parasympathetic control has most of its influence on heart rate that is equal to or less than 100 beats per minute. So we can see with parasympathetic stimulation, we have slower depolarization, decrease in heart rate, decrease in conduction. Sympathetic nervous system. The sympathetic nervous system usually predominates at a heart rate above 120 beats per minute, so under exercise conditions. If we have an increase in sympathetic innervation, we'll have an increase in heart rate, increase in conduction. So this is our fight or flight response. What will happen is we have a release of norepinephrine, which will stimulate the beta-1 receptors of the heart. So again, an increase in sympathetic influence will increase heart rate and conduction. Other extrinsic factors that will have its effects on heart rate, we have hormones. Hormones, specifically, we have hormones that are sympathomimetics. So basically, these are chemicals that will mimic the hormones of the sympathetic nervous system, such as norepinephrine and epinephrine. And these sympathomimetics have sympathetic activity, meaning they'll increase heart rate as well as increase conductance. Other hormones that have their effect on heart rate include the thyroid hormones, T3 and T4. We know that, hormones will increase heart rate, so they have a positive chronotropic effect. But there are no known hormones that will decrease heart rate, because what can happen is if we have hypersecretion of hormones that decrease heart rate, this usually can make the heart stop and cause death. So there are no known hormones that will decrease heart rate. Other extrinsic factors that will have their effects on heart rate include heat. So for example, an increase in body temperature will increase heart rate. So here we see the first part of our table being filled out for heart rates. Intrinsic factors that will have its effect on heart rate includes the autorhythmicity of the heart, predominantly the SA node, which generates the rate of the heart. And then extrinsic factors that have their effect on heart rate include the autonomic nervous system with its dual innervation at the SA node and the AV nodes, having its effects on depolarization as well as conduction. So parasympathetic nervous system, rest and digest will decrease heart rate as well as decrease conduction, whereas the sympathetic nervous system, increase in activity, will increase heart rate. And we know that the parasympathetic nervous system has its influences, its effects on heart rate about 100 beats per minute or less, whereas sympathetic nervous system will predominate or have its influence mostly on a heart rate that is 120 beats per minute and above. Other extrinsic factors that affect heart rate, we have our hormones, all increase heart rate. So we have our sympathomimetics as well as thyroid hormones. And then other extrinsic factors include body temperature. So an increase in body temperature will increase heart rate. The next variable that we're going to talk about is stroke volume. Stroke volume, again, is the amount of blood pumped by one ventricle during contraction. And we had two researchers, Dr. Frank and Dr. Starling, that described the relationship between stretch and force in the intact heart. Basically, the Frank Starling law of the heart is you pump what you get. It comes down to the more blood the heart gets, the more it will pump out. So what we see is the Starling curve, whereas the x-axis represents the end diastolic volume, which is a measure of stretch in the ventricles. The y-axis represents the stroke volume and is an indicator of the force of contraction by the ventricle. So the graph shows that the stroke volume is proportional to end diastolic volume. As additional blood enters the heart contracts more forcefully and ejects more blood. So you pump what you get. So within physiological limits, the heart pumps all the blood that returns to it. Stroke volume increases as end diastolic volume increases. And this is the Frank Starling law of the heart. An increase of blood volume will cause stretch, and it will increase the strength or force of contraction. Another intrinsic factor that affects stroke volume is preload. Preload is the pressure of the ventricle before ejection. We talked about in our lectures how pressure differences will move blood, and usually blood will move from areas of high pressure to low pressure. So as the blood fills the chamber, it increases the pressure within that chamber. And an increase in that pressure will increase the strength of contraction and therefore increasing the stroke volume. So preload basically means if you have an increase of pressure within the ventricle right before ejection, you'll have increased strength of contraction and increased stroke volume. Now we talk about the extrinsic factors that will affect stroke volume. Of course, we have to first talk about the autonomic nervous system. The parasympathetic nervous system has a very small effect on stroke volume due to very sparse innervation of the parasympathetics in the ventricles. However, we will still have a release of acetylcholine, which will stimulate muscarinic receptors. And what will happen is it will cause a decrease in the concentration of calcium ions. So a decrease in this concentration of calcium ions will therefore decrease the strength of contraction, decreasing stroke volume. Sympathetic nervous system, we have the release of norepinephrine, which will stimulate beta-1 receptors. Sympathetic will increase calcium ion concentration. An increase of calcium ions will therefore increase the strength of contraction, also increasing stroke volume. Hormones, another extrinsic factor. Again, we have our sympathomimetics that will, of course, act like the chemicals in the sympathetic nervous system, which will also increase strength of contraction, increasing stroke volume. So just a little side note, the parasympathetic nervous system doesn't have a huge role. If we were to have a large parasympathetic effect, this would cause death. Again, we talked about how parasympathetic effects would either stop the heart and therefore cause death. So then we have other extrinsics. We have something called calcium conductance. Now, what calcium conductance is the increased movement of calcium ions across the cell membrane into the cell. So if we have an increase of calcium ions crossing the cell membrane into the cell, this increases the strength of contraction, which again will increase stroke volume. So here we just see a picture of the movement of calcium ions into the cell, and you don't really need to know the specifics of this picture. Just know that calcium conductance is a way of extrinsically controlling the variable of stroke volume. Another way to regulate stroke volume is afterload. Afterload is basically the pressure that is pushing back on the ventricle. So pressure outside the heart that's pushing back on the ventricle. Also, the pressure that the heart has to overcome in order to eject blood. This is known as the diastolic blood pressure in the outlet, or in the semilunar valve. So if we know that a normal blood pressure is 120/80 millimeters mercury, afterload is the same as diastolic blood pressure. So in this case, afterload will be about 80 millimeters mercury. So an increase in the afterload, or increase in that pressure that is exerted on the ventricles, will decrease stroke volume. So afterload is inversely proportional to stroke volume. So in order to pump blood out of the heart, we have to have return of blood to the heart. And diastolic volume is normally determined by venous return. This is the amount of blood that enters the heart from the venous circulation. We have, according to our book, 3 factors that affect venous return. The first factor being the contraction or compression of veins, returning the blood to the heart, specifically within the skeletal muscle. So that skeletal muscle pump affects venous return. We have pressure changes in the abdomen and thorax during breathing. This is the respiratory pump, basically the same as the skeletal muscle pump, but instead located within the abdomen and thorax. So the respiratory pump allows for venous return back to the blood. And then we have sympathetic innervation of veins. Vasoconstriction or venoconstriction, again, will increase venous return to the heart. So in order to have more blood pumped out, we have to have more blood returning to the heart. So we continue to fill out this table. Now we can see stroke volume being filled out. Intrinsic factors affecting stroke volume include include the Frank-Starling law, where stroke volume is dependent on the blood volume returning to the heart. Also, stroke volume is dependent on pressure of the ventricles before contraction or the preload. So both an increase in volume and increase in that pressure, that preload pressure, will increase stroke volume. So showing a directly proportional relationship between stroke volume and these factors. We then have our extrinsic factor. Or extrinsic factors. So, of course, we have to think of the autonomic nervous system with regards to how it affects calcium ion concentration. The parasympathetic nervous system not having a large impact, but it does decrease the calcium ion concentration, which will then decrease strength of contraction, thus decreasing stroke volume. Whereas the sympathetic nervous system will increase the calcium ion concentration, which will increase the strength of contraction, increasing stroke volume. Then we have our hormones, our sympathomimetics that mimic the hormones or the chemicals of the sympathetic nervous system. Our sympathomimetics, again, will increase stroke volume. And then other extrinsic factors that we need to consider include calcium conductance. An increase in calcium conductance will increase stroke volume. Afterload. Afterload being that pressure, that outside pressure that's being exerted on the ventricles. We know that afterload is inversely proportional to stroke volume. So an increase in afterload, you'll have a decrease in stroke volume. And then venous return, following the Frank-Starling law, increased venous return will increase volume, increasing stroke volume. Stroke volume. So the next variable that we're going to take a look at is total peripheral resistance. And total peripheral resistance is determined by arterial diameter. So we have intrinsic factors that affect arteriolar diameter. One of them is myogenic autoregulation. Myogenic autoregulation basically means the arterioles themselves can have the ability to change their own diameter in response to stretch and pressure. So, for example, an increase in blood pressure causes stretch of the smooth muscle fibers in the arterial wall. This causes constriction of the arteriole and a decrease in blood flow through the arteriole. So arterioles are able to kind of auto-regulate their own diameter, and this is again in response to stretch and pressure. Other intrinsic factors include the local chemicals. So local chemicals all cause vasodilation. So arteriolar diameter is increased by local chemicals, and usually the chemicals rely on diffusion. So again, causing a vasodilation. Some of the local chemicals include metabolic products. So metabolic products, just examples of things that can cause local dilation, especially in response to exercise. So for example, we have carbon dioxide, hydrogen ions, lactate, and ADP or adenosine diphosphate, all products of metabolism. Now, in response to exercise, it causes an active hyperemia. So active hyperemia just means an increased blood flow due to exercise. Other local chemicals include dilators such as potassium, nitric oxide, adenosine, and histamine. Again, causing a vasodilation. For extrinsic influences for the autonomic nervous system, blood vessels are exclusively innervated by the sympathetic branch only. So we have the release of norepinephrine, which stimulates alpha-1 receptors. causing an increase. So an increase in sympathetic activity will cause a vasoconstriction, whereas a decrease in sympathetic activity will cause vasodilation. So again, blood vessels innervated only by the sympathetic branch of the autonomic nervous system. Other extrinsic influences include hormones. All hormones all cause constriction. And then we have sympathomimetics again, mimicking the chemicals of the sympathetic nervous system, for example, epinephrine binding to alpha-1 receptors, causing sympathetic influences. And then we have other hormones such as angiotensin II or A2. And then we have oxytocin and antidiuretic hormone. These two hormones specifically, oxytocin and antidiuretic hormone, also known as ADH or vasopressin, these two are released by the posterior pituitary gland. And again, all these hormones causing a vasoconstriction. And we'll talk about specifically what antidiuretic hormone does in the urinary physiology part of this semester coming up. So now we have the intrinsic and extrinsic factors that affect total peripheral resistance, specifically how they affect the diameter of the arterioles. Please take note of the units for each variable. For example, heart rate can be measured in beats per minute. Stroke volume can be measured in milliliters per beat. And total peripheral resistance is a little bit more difficult. We can see that total peripheral resistance, or TPR, is equal to minutes times millimeter mercury over milliliters. And you could potentially see these units again